Electro Acupuncture is a great technique to save time and improve your clinical efficacy in your clinical practice. In this video, we'll present Electro Acupuncture and show you how to use Electro Acupuncture safely for best clinical outcomes. Electrotherapy is nothing new. Even in ancient Greece, people were using electric eels in foot baths to strengthen the blood circulation and relieve pain. After World War II, Chinese acupuncturists started to think about how to use electrotherapy and combine it with acupuncture. So what they did is they used electricity and gave some stimulation on needles to produce some analgesia for surgical operation. It is now a widely used technique used for treating neurological conditions, chronic pain, and also chemotherapy-related nausea. Electroacupuncture is actually a great way to replace hand stimulation of needle, and it's also a very good way to improve nerve function in general. We will now see how to conduct electrotherapy in the clinic. Now we're going to show you how to do electroacupuncture. So before you start to do the electroacupuncture, you will need to have your equipment ready, including your needles, the TNS machine over here, your sanitizer for your hands, and the patient has to be in a comfortable position. You need to make sure the patient can stay like this for 20-30 minutes of the treatment. And once you are ready, you can start with the needling. So Linda, I'm now going to put some needles here on your lower back and here on your legs. Are you ready?
Yep, I'm ready.
Yep. Good. Okay. Good. Going to do the other one. Okay, let's do the legs. And the other leg. Okay, so now the needles are in place and I can start to use my TNS machine. Before you start, you need to make sure the power is turned off and the TNS machine is close to your patient. You may want to make it a bit closer. Now we're going to put the wires on the needles directly. So what you want to do when we're doing electroacupuncture, we avoid having them connected to opposite side of the body, so one on the left and one on the right. So we don't want to do that. We're going to connect them to the same side, alright? So here I have the wire here on this side, and this is on one side. Okay, so we have the same side. I'm going to put the second one on the right side of the body. So again, the wires, they don't cross the body. Here we go. Now, I will first adjust the frequency of the electricity. So the frequency, if it's a high frequency, we'll call it dense wave. In this case, it will reduce the sensitivity of the nerve, so it's very good for pain condition. If it's a low frequency, this will increase the muscle tension. So this is very good for atrophy, for example, or muscle weakness. There is also dense pulse wave, which is a combination of dense wave and sparse wave, and this is good to improve metabolism, to increase the blood flow and also to reduce the inflammation. Today we're going to treat lower back pain. That's why we are going to use high frequency, okay? So I'm turning the knob here to get a high frequency, and we are going to use just these two wires, okay? So I will start. So now I need to turn the machine on, but before I do that, I have the intensity turned back to 0. So you have really to be careful about this. This is very important. Make sure everything is back to 0 before you turn the machine on. And now it's on. I'm just beginning to increase the intensity. So on the left side first, and it has to be very gradually, very slowly. So you don't want to rush in this process. So Linda, I'm going to increase the intensity of the electricity. You will start to feel some stimulation at the location of the needle, maybe some twitching as well. This is all very normal. If it's too strong, just let me know at any time, okay?
Okay.
So we'll start on the left side. Do you feel something?
Yes.
Yes? Is it too strong or is it okay?
It's bearable.
It's bearable.
Oh, that's a bit
This
strong.
is a bit too strong. Okay, so I'll reduce it a bit. Is it better now?
Yes. That's better.
Awesome. I'm going to start the one on the right side now. Again, just let me know if you feel anything and if it's too strong. Can you start to feel anything?
Yeah, a little bit.
A little bit.
Okay, now it's stronger.
It's stronger. Okay. It's not too strong?
No, that's bearable.
It's bearable. Awesome. So I'm going to leave you this way for 20 minutes and I'll check back on you a few times. All right?
Okay.
I hope you enjoyed this video. My name is Yoann Birling, clinician, lecturer and researcher. This video was produced by Sydney Institute of Traditional Chinese Medicine. Please check our tutorials and more information on the school in the description below. You can join our community and also give this video a thumbs up if you liked it. Good practice and take care.